Hello, I'm Erica McGough, and this is a brief discussion of Case Study 17.1 from the Clinical Assessment Workbook by Elizabeth Pomeroy for my Colorado Christian University class, Psychopathology. Question 1. Whom else would you like to talk to about Mrs. Corbin's situation? In this case, I would like to speak in depth with both her son and her daughter about their most recent interactions and conversations with their mother in an attempt to more closely examine Mrs. Corbin's history since her husband died a year ago. Since her husband died, I would be interested in finding out about her level of independence and functioning. Does she pay her own bills? Is she able to run errands, and is she still able to travel and drive successfully? Does she rely on any outside help for any task? I would also want to examine their recent conversations with their mother to examine if her cognitive memory or her emotional state has declined in any way. I would also speak to Mrs. Corbin's close friends, since they do live locally, and see if her demeanor or her level of functioning has changed recently. I would also want to re-interview the nurse privately and speak with Mrs. Corbin's doctor about her hospital stay so far and check if she was on any medications prior to being admitted to the hospital or if she had been put on medication since being admitted. Question 2. Looking back on the interview, is there anything you would have done differently? If so, what and why? Prior to interviewing Mrs. Corbin, I would have personally privately talked with the nurse and later confirmed with Mrs. Corbin's friend and family to see if there was any known history of Mrs. Corbin falling or if she had had any prior strokes. Given the interactions with Mrs. Corbin and the fact that the nurse stated that she seemed to be confused and mistook the nurse for her own daughter, I would have asked her some simple questions to examine her mental state, such as, what is your name? What age are you? What month it is? Do you know where you are? Do you remember my name? Etc. Question 3. What potential diagnosis would you rule out? In Mrs. Corbin's case, I would initially rule out neurocognitive disorder due to Parkinson's and Huntington's disease, as it appears that Mrs. Corbin has full motor functioning and no other types of physical impairment. Question 4. What is your preliminary diagnosis? Since Mrs. Corbin's state is highly fluctuating, and she presents with aggressive behaviors, attempting to spit and bite, and she also used profane language and grew very angry when I repeated a question about getting her a Coke to drink when she did not previously answer, I would examine disorders due to delirium. She seems to be aware that she is at the hospital and restrained, yet the nurse states that Mrs. Corbin has mistaken her for her daughter. Without interviewing Mrs. Corbin's friends and family, it's really unknown whether her symptoms have had a gradual onset or whether they appeared suddenly. Further medical tests need to be run, such as a CT scan, and further health history needs to be taken to see whether there's a family history of disease. Because her symptoms seem to have appeared suddenly, and I do not have a current health history, medication history, or any information about her recent mental state, I would diagnose her with other specified delirium, code 780.09, until further information could be obtained. Question 5. List the psychosocial and cultural factors as V or Z codes that would apply to this case. Possible codes that would apply to Mrs. Corbin's case are as follows: 780.09, R41.0, other specified delirium. Also, since it is unknown whether Mrs. Corbin is successfully caring for herself or if her cognitive function or emotional state has gradually declined, but given her age and the evidence of decline in current memory and social functioning in the hospital, major neurocognitive disorder or mild neurocognitive disorder due to Alzheimer's may also be possible diagnoses. And these codes are 331.9, G31.9, and 331.83, G31.84, and both of these would present with behavioral disturbance. Thank you.